Wednesday Q&A, and we are back with a question about glute exercises for strength. So the question that came in was wondering about some examples of glute leg exercises to maintain some tone and strength, and this particular person is in their 3rd trimester of pregnancy. So Beck, being our resident pre and postnatal exercise specialist, very happy person to have as my partner here, is going to answer this question for you.
Alright, so yeah, the glutes are really important to train your leg exercises as well. So as you get a little bit further along, belly's getting a bit bigger and sometimes it might be a bit uncomfortable in certain positions. Especially if you're on, say, all fours in that prone position when you have your belly sort of hanging. It might be more comfortable to do more standing or seated or sideline glute exercises. So just a few examples in a standing position. Band or monster walks, where you have the band around your feet or just above the knee, so the lower part of the thigh. Side walks are really good to hit those glutes. Sumo squats, general lunges are really good, focusing on pushing off through the heel. If you're doing, say, power lunges, really good for the glutes. And if you're in a seated position, so the band hip abduction, so if you've got the band sort of around the lower part of the thigh again, seated, tilting forward and pushing the knees out are really good to hit the glutes. And then if you're in a side lying position, so band, side lying. Leg lifts are really good, so you might have the band, so the bottom leg bent, the top leg straight, pushing through the heel. Side leg lifts are really great. What else? Clams with some internal external rotation is really good. And if you're in that prone position,
which is face down,
so let's say you're all fours or on your forearms and then on your knees, doing leg kickbacks, the toe tap across, which we're going to demonstrate. We'll do a YouTube video with these demonstrations as well.
So we're just running through them here, and you can Google these exercises.
Yeah.
But then Beck is going to do
I'll do some demonstrations.
for us.
I'll try and get them done this week for you.
Yeah.
What are we up to? Donkey kicks. So this might also be one if you're having any pelvic pain. Doing this one, so if you're on all fours and then kicking your heel towards the ceiling, might be a little uncomfortable for some women. But some others might be completely fine, so it's all a bit of trial and error.
So if it's uncomfortable, avoid it?
I'd probably just modify it. So instead of kicking all the way up, you might go to extending the leg in your all fours position and just doing like really small leg lifts.
Like a little pulse kind of
thing?
Yeah,
you can do little pulses.
So you're activating the muscle rather than doing a full strength movement.
Absolutely. Yeah,
absolutely. Because activation is great as well. We'll go into that.
Yeah, and a lot of these you can use in part of your warm-up or as part of your workout, so lots of glute activation, so all those postural changes which Steph will go through will affect everything. So yeah, as you get further along, as I was saying, as your belly gets a bit heavier, if you find in that all four position where you can't, if you're exhaling, contracting your core muscles, but you still feel like you kind of have to grab your belly to support yourself in that position, maybe modify it, move to a seated position or a standing position when you're doing your leg and glute exercises. So it's a really good tip.
Yeah.
Steph, would you like to
lots of great exercises
there.
Yeah, so I was just going to talk a little bit about why these exercises are necessary. So as you go through the later stages of pregnancy, you might start to feel more uncomfortable, your centre of gravity is moving forward. A lot of women don't feel uncomfortable at all, so it just depends on your individual circumstances. But the things that I see in my practice with my wonderful pregnant women is as that centre of gravity moves forward and you're near the end of pregnancy, it becomes a little more, and of course as relaxin kicks in. Now relaxin is the hormone that allows your pelvis to open, allowing baby to come through, so it relaxes the ligaments. As that kicks in, your muscles should activate a little more naturally, so you should have a higher muscle tone. But if you have that inherent strength and that little bit of core strength, the glute strength, the quad strength to stabilize you, it can just really help minimize the possibility of low back pain. It can help you hold yourself a bit more upright. And I find in clinical practice, when women aren't holding themselves as upright as they should be, it increases the incidence of osteitis pubis, which is pubic symphysis pain. So your pubic symphysis is that bone right at the front of your pelvis. And if the belly, so I see women, they come in and they can be quite forward, which is putting pressure directly on that joint. so it can get quite irritated.
Yeah.
So keeping your glutes nice and strong and your quads nice and strong helps you hold yourself upright.
That's good posture.
As well, we're always checking to see that, you know, your posture's nice and aligned, so we want your pelvis to be nice and aligned. We don't want any big upwards and forwards rotations. Now, all of these things, you're going to be able to birth just fine if you've got these things going on, but the stronger you are and the more, well, just really your stability and the activation of your muscles, I feel the better off you will be.
Absolutely.
Because we see these pictures, I mean, I haven't given birth before, Beck has twice. And I think there's kind of there can be this common misconception amongst people who haven't given birth before that, you know, from the movies, that we all give birth on our backs, which, as we know, is one of the worst places for you to give birth, unless you have to be there because you have an epidural or something like that.
Yeah.
But, you know, if you're labouring for hours and you're actually labouring standing up...
squat position for
exactly.
a while.
You want those legs to be nice and strong. I mean, you've got support, you've got people helping you and stabilising you, and you're going to be moving around, but it just makes sense to be nice and nice and strong and have those muscles activating properly before you go into labour.
And it'll help with the aid and recovery as well, and help you throughout motherhood. Being stronger already, you have that foundation. So
a little note on that is the common things that we see postnatally in mums that I'm checking after they've given birth is low back pain from lifting baby, lifting and carrying baby, and upper back pain and shoulder pain from breastfeeding. So that strength and muscle activation helps you hold your posture upright. Absolutely. And helps you be able to lift and carry and get used to having bum on the outside with just that little bit more comfort. Wanted to add anything else about your kind of experience?
No, not really. I think we might just have to do a whole nother video on that.
Yeah.
For a while. They're both so different. Which one?
We'll get a demonstration video ready for you with Becca's going to be our demonstrator.
Yeah,
absolutely.
absolutely.
Maybe I'll do one or two.
Yeah, we'll get Steph working.
And
get those muscles moving.
We'll put a link to that on our Facebook page and in our Instagram so that you can follow on through those exercises, and we'll make sure that they are appropriate for third trimester, and we'll give you a couple of adaptations as well.
Absolutely.
Yeah.
Awesome.
Send any questions for next week, and until then, we'll see you next Wednesday.
Yeah. See you soon.